So now that we're done with heart and lungs, this is where we're gonna really dive in. We're gonna do a full neuro exam because his complaints seem to be neurological in origin. So we'll go into more detail with the neuro exam. I'm gonna do a full neuro exam. I'm excluding the first cranial nerve, olfactory, just because I don't believe that's contributing to this patient's complaints. If you wanted to throw it in there, it's just you get something that has like a distinct smell, like maybe coffee or a lemon. You have the patient close their eyes and you just put it in front of their nose and see if they can identify the smell. In this patient, just based on our general survey, he appeared awake, alert, oriented ×3. I wasn't really concerned about any defects in his psychological state, so I'm going to skip the mini mental status exam for this specific patient, but just know that that's a part of the full neuro exam. So with continuing on, we're going to do cranial nerves 2 through 12. In general, we're going to look for possible intracranial tumor, multiple sclerosis, and we're going to rule out nerve damage. If there's any deficits in any of these cranial nerves, it's going to help us identify what could be the cause of this patient's symptoms. Okay, so for cranial nerve 2, we're going to assess vision with visual acuity. In a perfect world, we'd have the Snell and eye chart on the wall, but because we don't, we have this guy right here. You're going to want to make sure that you're the appropriate distance away. You're going to want to have the patient, if the patient's able to, you can bring it out complete arm width from his body. He's going to cover his left eye first and read the furthest level down. He doesn't have to do that at this point. This is just for instructional purposes. You would have him switch hands, cover his right eye, read the furthest level down, and then he can uncover both eyes and again read the furthest level down, and that's going to just identify if he has any visual disturbances. Specifically on our differential, we have giant cell arteritis. In that condition, you can completely lose all vision. So if we had any vision loss or blindness, that could potentially determine that he has giant cell. Okay, so cranial nerve 3, we're going to do a test called pupillary reaction to light. And basically what you're going to do is you're going to take your ophthalmoscope and you're going to turn the light on, make sure that you're at the right setting here. And then you're going to go to the patient right here. You're going to tell him to look straight ahead at you, and you're going to put your hand right here, and you're going to flash a light into his left eye and see if his opposite eye also, if the pupil's constricting equally. You're going to do it on the opposite side. All right, in this patient, that's normal. If there's any abnormalities, you're going to worry about, again, blindness or paralysis. All right, so to finish up cranial nerve 2, we're going to do a couple more tests. First, I'm going to start with the fundoscopic exam. With this part, you're going to want to make sure you maintain your technique. So when you're looking through your ophthalmoscope and you're assessing the patient's right eye, you're going to want to look through the ophthalmoscope with your right eye, and you're going to want to come in laterally to medially. You're going to be looking for the red reflex. You're going to try to visualize the optic disc, and you're going to assess several things. The ratio, looking for papilledema. You're going to try to look for the arteries and veins, and then various other pathologies that could be present. But most importantly, you just want to maintain your technique. And then just like I just did right eye, I looked with my right eye into his right eye. With the left, you're going to look through your left eye into his left eye, using the same technique, looking for the exact same things. All right. So that's the fundoscopic exam. Next, we're going to do visual fields by confrontation. You're going to start from behind the patient, and you're going to wiggle your fingers, and you're going to ask the patient to indicate when he sees your fingers in his periphery. Let me know when you see my fingers. Yes. All right, and then you're going to do from top to bottom, same thing. Let me know when you see my fingers. Top. Okay, good. All right, and that's just going to assess like his visual fields, if there's any deficits in his periphery. And now I'm gonna do a test called accommodation. And what I'm gonna ask the patient to do is I'm gonna ask him to focus on something far away. And then when I tell him to, I'm gonna have him focus on something that's close, which is gonna be my finger. And you're just gonna assess for his pupillary response. So go ahead and focus on my finger. Focus on something far away. My finger, far away. And as they're focusing on something closer, you're gonna see their pupils constrict. When they focus on something far away, you're gonna see their pupils dilate. And then the last little test that we have for cranial nerve 2, it's gonna be convergence. So what you're gonna do is you're gonna ask the patient to focus on your finger, and you're gonna slowly move it towards their face, and you're gonna ask them to just try to look at your finger all the way. And as they're gonna do that, their eyes are gonna converge, and you're also gonna be looking for a pupillary response. Okay, so focus on my finger. And as you get closer, the pupils are gonna constrict. As you move further away, they're gonna dilate. And so then you're gonna move on and assess 3 cranial nerves in one test. You're gonna assess 3, 4, and 6. That you're gonna do the extraocular movements. You're gonna be checking for strabismus from paralysis, and you're gonna look for nystagmus. And basically, you're gonna ask the patient to follow your finger, making sure that there's no abnormalities. Okay, follow my finger without moving your head. You're gonna wanna make sure that you're going in the ladder formation. Hit the 6 points, both left and right. All right, I don't see any abnormalities in this patient.